Hello everyone. Now I'll discuss question of psychiatry. So we have a 50-year-old unemployed man presented with a 7-month history of progressive speech difficulty. He had appeared depressed over the same period after losing 2 jobs in the last year. His wife commented that he lost all motivation and spent most of the day at home. His appetite has changed and now he has become very fond of sweet foods, which has caused gain in his weight also. Where higher mental functions testing revealed problem with the naming and in tasks requiring planning. Examination of the cranial nerve and the limbs was normal. What is the most likely diagnosis is frontotemporal dementia. Well, why is the answer? In fact, when we talk about frontotemporal dementia, what we write as FTD, it's a collection of disorder affecting frontal and temporal lobes. Onset usually between 45 to 60 years, and family history positive in 40% cases. Our patient also fit into this age group. Okay. Now, when we are talking about FTD, there are 3 cardinal symptoms that can happen in this patient. One is the behavior disturbance. And in fact, it is one of the most common presenting feature. Patients usually have behavior problem, decreased motivation like in this, our patient also. Impulsiveness, disinhibition, and the loss of social skills. Now, let us discuss what do you mean by disinhibition. Because human being is a social animal and we follow the rules of society. For example, if a person wants to pass urine, he has to go to toilet and pass urine. A normal person will not stand in open and start passing urine in public. That is not a socially accepted behavior because we have certain inhibition as per the society rules. But in this patient, this becomes disinhibition. They have no inhibition. What are the basic physiology behind this? This is the cerebral cortex, central sulcus, motor cortex, motor. And this is the prefrontal cortex. This is the area of social behavior and personality. We follow the rules of society. We plan all by the prefrontal cortex in the frontal lobe. In this patient, this get damage or get disease. With the result, patient has no inhibition to there. And that's why disinhibition is a loss of social skill. All are lost because of a loss of prefrontal cortex. Second problem that can have is semantic dementia with present as a fluent aphasia, difficulty naming object because of loss of semantic knowledge. But now, what is semantic knowledge? If you go to the dictionary meaning, the means corrected with the meaning of words and sentences. In this, they have no sense of language, what we call as semantic dementia. Irrelevant speech is the better word we can talk about. Then we have progressive non-fluent aphasia where patient has difficulty in production of the speech is difficulty. This is so-called non-fluent aphasia. In nutshell, the problem is in the behavior, disinhibition, and speech problem may occur in these patients. Overlap syndrome may occur in one patient, other features can be there. It's not totally absolute. Patient often develop a sweet tooth or other changes in the appetite. Like in this patient also, patient start liking sweets and he gained weight also. That's a classical feature in this patient. There's a problem in planning a judgment and that's why he lost a job also. There currently no treatment for these dementias. They're all degenerative. Creutzfeldt-Jakob disease, sporadic form of rapidly progressive dementia with ataxia and myoclonus, classical feature. It is such a rapidly that death occurs within 1 year. It's a very rapidly progressive disease is there. The disease is caused by a prion. Now I have got certain questions for you. Stop the video, write down the answer. First of all, what is a prion? Is it a DNA? Is it a RNA? Is it an enzyme? Is it a hormone? Is it a protein? What is this? Okay, the right answer is it's a type of protein. It's an abnormal protein which makes normal protein into abnormal. It's a protein. Now I got two more questions. In this, which protein is seen in CSF examination? And what pathology is seen in the brain parenchyma? Stop the video, write down the answer in your copy. Well, as far as we get in CSF, we get 14-3-3 protein is elevated in CSF. As far as protein pathology is concerned, it's a spongiform. Type of pathology is there. Spongiform encephalopathy is there. Well, other option is dementia with Lewy body. It's disease affecting age over 65. Fluctuating cognitive impairment, memory, language, and visuospatial function. Motor sign of Parkinson are frequently seen. In fact, dementia is a late feature in Parkinson, but if you get it, then it's more dementia with Lewy body, what we write as DLB. Okay, and when we are getting feature of Parkinson like tremor, dyskinesia, rigidity, then you think about an associated dementia. Then you can think about DLB. But there's something more which is classical thing that we see in this patient, a type of hallucination. Stop the video, write down the answer. What type of hallucination are seen in these patients? Well-formed visual hallucination are the classical, very frequently asked question. So in DLB, visual hallucination, and number two, Parkinson-like feature, and finally we are getting fluctuating cognitive sign. These are the features that we think about dementia with Lewy body. Then we have one more option. Alzheimer's disease is the most common cause of dementia above the age of 65 years. Memory loss is a big problem. Word defining problem. Visuospatial dysfunction is very major problem in this patient. It's one of the important clue where we can think about Alzheimer's disease, and is the most common cause of irreversible dementia. Okay, behavior changes is uncommon in these patients. Like in our patient, it was more of a behavior problem which goes in favor of frontotemporal dementia. Huntington disease, slowly progressive chorea, and neuropsychiatric disturbance or cognitive impairment are well recognized feature. Okay, but when we are getting chorea in these cases is one of the important features that we are dealing with Huntington disease. And moreover, one more thing in Huntington disease, the usual age of presentation is 35 to 45 years, although it is the autosomal dominant condition is there. So golden line to remember: frontotemporal dementia, the three cardinal syndrome, behavior disturbance, most common, cementing dementia, and progressive non-fluent aphasia are the features. Thank you very much.